healthcare industry earlier, and I wanted to ask what you thought, what kind of changes you'd like to see in the healthcare industry.
Well, one of the biggest changes, I lived in Hawaii for 8 years, and I thought they had a very unique system there, which was very similar, in my opinion, to what it would be like in Canada. And that is, every employer has to pay insurance for their employee. And so every employee in Hawaii that's working more than 20 hours a week has health care. And it seemed to work out very well. It wasn't that expensive. It was not that expensive because you had everybody all inclusive. And it was very unique. And for some reason, nobody ever wants to talk about that, and I'm not sure why.
Why are some reasons do you think that can't happen in the United States? It seems like it's a simple plan, but what do you think?
Exactly. I don't know. And the only thing I can figure is that you've got too many insurance companies that would be involved, and yet there we basically had Kaiser, and there was one other plan that they had. Mm-hmm. But because everybody was insured by an insurance company, you know, again, it came right out of payroll deduction, and it was just very simple.
Yeah.
And maybe there's, you know, too much insurance companies involved. I don't think it would be doctors. I don't think they care. I don't know.
Do you think that there's anything going on in the pharmaceutical companies as far as how much it costs for medications and things like that, or?
I think that was separate, so I'm not sure. I don't, you know, again, basically, I felt that everybody was healthier because they always went to the doctor. They had a problem, they went to the doctor. They didn't wait and let it get worse because they didn't have the money or they weren't covered. You know, there was always that scenario that I found with many people, is that they just wait till it's almost too late, and then all of a sudden you've got a crisis on your hands.
We were talking about that movie by Michael Moore, you know,
yes.
with Sicko, and talking about how people almost have to make a choice between the money that they'd spend on being treated or the fear of not being treated at all. Can you talk about that for a second? Or?
Well, I think, you know, I hear various people that are right now either are losing their jobs or getting close to losing their jobs, or just don't have the money to properly insure themselves, and so they're in a shortcut scenario, and they're gambling. And I know there's percentages that I can't quote you the actual statistics of the people that don't have health insurance, but I know it's rather dramatic. Yeah. And I'm sure those people are working, but they still can't even afford it through their employer because the employers have cut back on the amount of contributions they've been making, and therefore, you know, they have no insurance. Mm-hmm. So again, it's that same problem.
And I know that kind of a closer to home cause for you is smoking and cancer that way. I believe one of your family members even.
Right. I lost my mother and my sister to smoking, and I guess I always was very frustrated with them smoking and tried to see what I could do to get them to quit smoking. And it was ironic because my sister was diagnosed with a lung cancer that was inoperable, and fundamentally they told her she'd have 2 years to live. And exactly 2 years she was dead. Mm-hmm. And the thing that I thought was ironic about it was that she smoked right up to the last. I mean, it was, and she was embarrassed by that, but it was such a habit, and I guess that's why I feel in a way that smoking is overpowering to certain people, whether it's their personalities or their mentalities or what, I don't know. But I find it very frightening that these people just continue to smoke even when they know there's a danger. Mm-hmm. And I think I mentioned to you that one of my jokes is that I see somebody smoking, and I said, oh, I didn't realize you were illiterate. You know, and they look at me like, what? Well, you know, have you ever read what it says on a package of cigarettes? Yeah. And I mean, it's very plain, and it's a very thorough warning, and there's no ifs, ands, and ifs about it. It's been proven, and yet people smoke. Yeah. And I thought, personally, that when they started, you know, when I was growing up as a kid, you could buy a pack of cigarettes for 20 cents. Buy a carton for, you know, $3.13, and now you pay $5 for a single package. I mean, it's crazy. Yeah. And that doesn't stop anybody. They're just spending more money. It means that the tobacco companies are getting more money. It means the state's getting more money on sales tax. Everybody's getting more money. Wow. So it's really kind of alarming when you think about it. It perpetuates itself, and the same people. Maybe it's good that it's being taxed, because I'm sure it's a lot of government agencies that are forced into being able to help these people because they don't have the capabilities or the money in many instances. You know.
Well, let's go big picture just for 1 second here. Obviously, healthcare is a major issue across the United States. What other issues do you see as being pretty important, especially in the upcoming 2008 elections?
I think the number one problem that we have, I mean, they talk about Social Security and Medicare and all the rest of that, but I think really health care is one of the biggest things. And I think when we can spend the amount of money we're spending now in Iraq in a war that has been judged by most people unwinnable, it just doesn't make any sense to me when we're not taking that kind of money and putting it into helping our people, either through education and or some sort of, you know, monies that go into the medical profession to help those people and cut back on those costs.
Yeah. Well, is there anything else you'd like to say to people across the country?
No, it's just that make sure you go out and vote in this upcoming election. I think that's one thing that I have always done. I voted in every election. Whether my candidate has won or not, or whether I thought he might even win, I still go out and vote. And I think that's very, very important, because that's the one basic thing of America that we have, is the ability to vote. And there are a lot of countries that don't have that ability. And I think we take that for granted, and I think that's very, very important, that we put the people in there that we want in the, you know, majority rules.
Absolutely. Once participation ceases to exist, so shall our precious democracy.
Exactly. And that's the other thing that kind of scares me with the younger generation. A lot of them don't care, or they don't register, they don't vote. You know. And I think that's important that one votes.
What can we do to get younger people out to vote?
Give them some incentive. You know, make them understand how the system works, and make sure our school system. I mean, I've known people that have graduated from high school and they can't balance their checkbook. Nobody ever showed them how. You know, things like that, where maybe they need to know how important. I mean, I'm assuming that they get a civics course, but maybe they don't. Maybe they don't know what elections are all about or how important it is.